Welcome back to the Holistic Health Bites podcast, where we discuss all things metabolic health. Today, we are talking about conditions most people don't know are connected to metabolic dysfunction. In no particular order, let's start with IBS. When cells of the intestines become dysfunctional, they literally can't do their jobs properly. This happens in part due to reduced mitochondrial activity, which means the cells can't make or use energy efficiently. This reduced activity contributes to abdominal pain, loose stools or constipation, and even changes in appetite based on the transit time of your prior meal. If you have IBS, you are twice as likely to also have metabolic syndrome and elevated triglycerides. Insulin resistance also damages or interferes with the enteric nervous system in the gut, altering the contraction and relaxation of the intestinal muscles. Insulin resistance also disrupts the gut barrier function, leading to leaky gut. This leaky gut can cause inflammation, chronic infections, food sensitivities, and many other systemic problems outside of the gut. Next up, acne. Elevated insulin and blood sugar drive hormonal changes that can cause acne to develop. Insulin can lead to higher levels of male hormones that can produce extra skin oil, which can then clog the hair follicles and give bacteria a place to grow. Those with acne have also been found to have higher levels of oxidative stress and mitochondrial damage, which can lead to conditions like alopecia areata, atopic dermatitis, lichen planus, scleroderma, vitiligo, rosacea, sun damage, and psoriasis, and so many other skin conditions. An interesting side note, many people, myself included, have noted far less sunburns when eliminating industrial seed oils and reversing insulin resistance. Next up, depression. Mitochondrial dysfunction, inflammation, and oxidative stress are involved here too, much like it does in the gut. The gut-brain axis is a communication pathway between the digestive tract and the central nervous system. The gut microbiome plays a huge role in the regulation and production of key neurotransmitters responsible for mood and behavior. Anything that disturbs the gut can also strongly impact the brain and mental health. This is why IBS and depression have such a strong link. Depression results from mitochondrial dysfunction, reducing energy production, alterations in neurotransmitter signaling, inflammation, neural cell death, and alterations in the stress response. Unstable blood sugars cause more stress and cellular damage. One study even showed that for every 18 milligrams per deciliter increase in blood sugar, there was a 37% higher rate of depression. There have been numerous reports of connections between metabolic dysfunction and suicidal ideation. Next up, chronic pain. Again, mitochondrial dysfunction plays a role here, along with alterations in neurotransmitters. Insulin resistance also alters the cellular metabolism in muscles and nerves, leading to a loss of muscle tissue, degradation of the joints, and other associated causes of pain. Next up, a related case, arthritis. Arthritis is inflammation of the joint tissue that causes damage, leading to pain. The cause of the inflammation can be oxidative stress, excess weight, sedentary lifestyle, poor diet leading to nutrient deficiencies, stress, and toxins. Next up, hearing loss. Age does have an impact on hearing due to many years of damaging noise and other factors that can cause harm, but not all hearing loss is inevitable. Insulin resistance can alter energy production and utilization in the auditory system. This very delicate system requires a lot of signal coordination and has very tiny capillaries that support and transport blood and nutrients. These capillaries are very easily blocked, depleting those nutrients needed for proper cell signaling. One study showed that people who had elevated blood sugar had 42% more hearing impairment compared to only 24% with normal blood sugar subjects at the same age. Next up, sinus issues. Elevated blood sugar increases the likelihood of developing inflammation of the sinuses, even 2.7 times higher if you have type 2 diabetes. The same inflammatory markers can increase with sinusitis as they do with heart disease, obesity, and type 2 diabetes. The same inflammatory cascade is showing up in different ways. Next up, autoimmunity. Many autoimmune conditions have been linked to metabolic dysfunction. Those with conditions like Sjogren's syndrome, Hashimoto's thyroiditis, rheumatoid arthritis, multiple sclerosis, psoriasis, irritable bowel disease, lupus, and more are more likely to develop obesity and type 2 diabetes. When the cells can't make energy properly, they send out danger signals, which can cause the immune system to invade, sometimes attacking its own tissues. People with autoimmune conditions have 1.5 to 2.5 times the rate of insulin resistance and metabolic syndrome. Next up, migraine. People with migraines tend to also have higher insulin levels and insulin resistance. Nutrient deficiencies are also tied to migraine development as they are necessary for mitochondrial function. Micronutrients like B vitamins, vitamin D, magnesium, CoQ10, alpha-lipoic acid, and L-carnitine specifically. Now, while we're talking about nutrients, please do not just rush out and buy the first multivitamin or supplement you can find. Most of these nutrients can be obtained readily in a quality, well-rounded diet. Many supplements on the market aren't of ideal quality and may not be even in absorbable forms. And they may not have anywhere near enough of the nutrient to do you any good. I am absolutely not against supplements, but most of what you'll find in your local grocery store, pharmacy, or vitamin shop really aren't the best options. Food first, then quality supplements for additional needs. Back to migraines. B12 specifically has been shown to be very helpful in preventing migraines. On a related note, other types of headaches are also related to blood sugar imbalances. Next up, infertility and hormone imbalances. In females, polycystic ovarian syndrome, PCOS, is the most common cause of infertility. In males, erectile dysfunction is the leading cause of infertility. Both can be directly related to insulin resistance. In PCOS, insulin is the driving force, causing the theca cells of the ovary to produce more testosterone, which alters the production of the other sex hormones needed for proper follicle development, ovulation, and for menstrual cycles. Nearly half of all females who have PCOS also go on to develop type 2 diabetes. Unfortunately, modern medicine tends to recommend synthetic hormones or expensive and invasive medical procedures to assist in female fertility, failing to address the fact that those with metabolic dysfunction have more than double the risk of miscarriage. So you could go through all of those expensive and painful fertility treatments only to end up miscarrying if you don't address the root cause. In males, sperm count has decreased by 50 to 60% in the last half century, with an 81% chance of having no sperm at all in obese males. Obesity in males causes more testosterone to convert to estrogen, where the body fat is actually acting like a big ovary, as Dr. Ben Bickman likes to say. Fat tissue produces an enzyme called aromatase. This is a normal biological enzyme responsible for making the normal conversion of testosterone to estrogen. Again, this is a normal process. All estrogens originate as testosterone. However, when the body fat increases, so does the aromatase enzyme, which can lead to much higher levels of estrogen and much lower levels of testosterone, the exact opposite of what males need for ideal health. Oxidative stress also damages the sensitive sperm cell membranes, impairs sperm development, and damages sperm DNA, reducing the sperm quality and increasing the risk of miscarriage. This same oxidative stress also naturally decreases testosterone production. Erectile dysfunction, or ED, is caused by changes to blood flow in the tissues and nerves needed for proper erectile function. Miscarriage rates have increased by 10% in the last decade alone, which can be due to any of the factors we've already discussed or even placental dysfunction, leading to issues with nutrient and oxygen delivery, waste removal, hormone synthesis, and immune regulation. Next up, chronic fatigue. The most common cause of medical visits is due to fatigue. 67% of people in the US report regular fatigue at work. 70 million people report sleep issues, and 90% of people are consuming caffeine every day. Reduced energy production, unstable blood sugars, Hormone imbalances and sleep disturbances are contributing to persistent fatigue. The lack of sleep is both caused by and worsens metabolic dysfunction. Next up, obesity and fatty organs. Obesity has dramatically increased in adults and children over the last 50 years. Fatty liver disease used to be mostly caused by alcohol consumption and hepatitis C infection. Now it's much more commonly in adults and children, caused by metabolic dysfunction due to poor diet, stress, and toxins. I've done many prior episodes on fatty liver on this podcast before. Go back and listen to episodes 75, 85, 116, and 131 specifically if you'd like more information on fatty liver. The fat doesn't just accumulate in the liver though. Any tissue can be infiltrated with fat in a metabolically unhealthy state. This can lead to pancreatic dysfunction, difficulty swallowing, kidney filtration issues, brain and cognitive changes, increased cardiovascular disease, and more. Next up, ADHD and other brain disorders. We think of conditions like ADHD and autism as childhood diseases, but they can affect people well into adulthood, as can childhood depression, anxiety, and other mental health disorders. Studies have shown that a mother with obesity and diabetes has 4 times the risk of having a child with autism and twice the risk of having a child with ADHD. Next up, frequent infections. Many kids get sick a lot, yet some seem to get everything. Frequent ear infections, recurrent sore throats, and bouts of the flu. The same is true for adults. Some get everything going around, and some get the worst cases of everything they catch. Are they just unlucky? No. This can also be directly linked to metabolic dysfunction. If the cells can't make energy properly, this can impact how efficiently and effectively they can mount an immune attack. Poor diet associated with metabolic dysfunction is also lacking in the key nutrients needed to fend off attacks, setting up an environment for bad microbes to take hold. The chronic inflammation associated with metabolic dysfunction is also distracting and depleting the immune system on a daily basis. Add to that the damage done to the microbiome from frequent antibiotics, NSAIDs, and over-the-counter cold remedies, and every other medication, and the cycle perpetuates. Next up, COPD and respiratory issues. COPD is the leading cause of respiratory disease and is caused by inflammation that damages the lung tissue. Smoking increases the risk of COPD by causing damage to the mitochondria in the lungs. However, COPD can develop in non-smokers as well. Studies have shown those who have been diagnosed with COPD saw improvements in their symptoms when they improved their blood sugar levels. Next up, stroke. Elevated blood sugars most directly damage the blood vessels. Those with prediabetes have a 60% higher risk of stroke than those with normal blood glucose levels. Insulin resistance leads to excess blood clotting, reduced nitric oxide production, and therefore reduced blood vessel dilation, and increased plaque formation. Next up, dementia. The brain is an energy hog. When metabolic dysfunction sets up in the brain, many cognitive and mental changes can happen. When the brain tissue struggles to take up glucose due to insulin resistance, this can starve the mitochondria of needed fuel. Without the mitochondria being able to make energy, the brain tissue can suffer, and many issues can appear throughout the body that are driven by brain activity. Alzheimer's disease is being referred to as type 3 diabetes because of its connection to insulin resistance of the brain. Next up, heart disease. Just like we've discussed with the stroke risk, blood vessels are one of the first tissues damaged by elevated blood sugars. This directly increases the risk of atherosclerosis. Along with the reduced nitric oxide levels, the blood vessels become more rigid and less flexible, and this alters blood pressure. Elevated blood pressure also puts strain on the blood vessels, increasing the risk of damage. Insulin also alters the production of several hormones like aldosterone, which plays a significant role in blood pressure regulation, kidney function, and mineral balance. Now, this by no means is an exhaustive list of the conditions either directly caused by or worsened by insulin resistance and metabolic dysfunction. Hopefully, this opens your eyes to the wide-ranging symptoms, diagnoses, and diseases that are connected. While addressing metabolic dysfunction may not entirely remove your risk of developing these conditions, and it may not fully resolve any that you already have, you absolutely will feel better with improved overall function by addressing your metabolic health. Until the next, be well and vibrant.